Child participation is a crucial need of the hour, as they are the future generation. Children and young people are encouraged and enabled to give their ideas and influence for policies and practices. So I am honored to welcome Ms. Prajna, 12th standard. Currently, she is going to 12th standard. She is the spokesperson of our flagship program called CAT, which is Children Against Tobacco. She has been associated from her early childhood. For say, she is associated with MAC from her first standard onwards. She will be the host of this webinar. She will coordinate this session, and all the speakers and children. I welcome all of you. I request all the speakers to actively participate, and adults, especially adults, I request all of you to observe the session. And in case you have any suggestions or feedbacks or queries, you are free to leave it in the chat box. You can type it in the chat box and we will answer to you. Let this forum be for the children. So I hand over the session for Ms. Prajna and she will take care of the entire session. Ms. Prajna, you can carry on from here on. Thank you.
Thank you, ma'am, for such a wonderful introduction. It is an honor to be here. And I'm also really proud that today I get to host this program along with so many other children who are actively fighting against tobacco. So let me just present 1 minute. Can everyone see my screen?
Yes, ma'am, your screen is visible.
Okay. Thank you so much. So let me introduce myself again. So my name is Prajna Arun. I am a CAT leader and I'm also the CAT spokesperson. I'm currently in 12th grade and I'm from Einstein Public School. Today, I'm going to be speaking about the role of Children Against Tobacco, that is CAT, in sensitizing students against tobacco. So, to introduce about why we are having this discussion today, let us explore the facts that we know. Tobacco use is the single largest cause of preventable deaths. And I would like to emphasize that this death is preventable. Like, this is in our hands and we can prevent it. 9 out of 10 who smoke cigarettes start tobacco use at the age of 18. 14.6% of students in India aged between 13 to 15 years use tobacco. And with this fact, we can clearly see that there is a rising incidence of people who use tobacco, especially at a young age. And there is an imminent need to sensitize students about the detrimental effects of tobacco. This is why CAT serves as a platform for young minds to voice their concerns, share knowledge, and inspire collective action. It is an organization under Mary Ann Charity Trust based in Tamil Nadu. At CAT, we believe that knowledge and sharing of knowledge is the best way to empower young children. Aims and objectives of CAT is to sensitize students between 8 to 18 years about the harmful effects of tobacco. We also aim to empower them through leadership programs where students learn to advocate, and we also aim to educate them regarding the anti-tobacco laws and to report violations against the tobacco laws. Here are the activities of a CAT unit. We create a tobacco-free zone around 100 yards of a school and conduct surveys of the zone. This means that there should be no shops and no vendors who are selling tobacco. This is very important because the more children encounter tobacco in their environment, the more likely they are to use it when they get older. We also aim to educate the peers about the hazards of tobacco usage and the tactics of tobacco industry, sensitizing the parents and community on the evils of tobacco and motivate them for cessation. We have so many stories of children who encourage their parents to quit smoking. We all know that, children learn from their parents, but the opposite can also be true. A lot of the times, parents want the best for their children, and when their children are advocating for a childhood without tobacco, parents are more likely to quit. Conducting competitions like painting, drawing, essay writing, and exhibitions related to tobacco eradication, art and literature is a powerful way to send messages. So this is why we conduct competitions as well. We also conduct CAT's Day Out to monitor tobacco-free zone for any tobacco control violations and reporting them through the tobacco monitoring app. And we conduct monthly meetings to share, evaluate, and initiate new activities. This is CAT's introductory program. It is a 1-hour training program for children between 8 to 18. It sensitizes children about the ill effects of tobacco, types of tobacco, tactics of tobacco industries, and COTPA. So the thing is that when tobacco industries are advertising, a lot of the time it is subliminal. We don't essentially recognize that we are being advertised to. Like in movies, we see so many of our favorite actors who smoke, and when we see it, we don't register it as bad because those are movies that we like. So when we get older, we are more likely to accept smoking as a normal, culture, and due to peer pressure, often we end up smoking, which is why it is important for us to advertise that this is not a good thing to do and also create forces for good. Yeah, here are the methodology that we adopt. Number one, we have an input session where we basically introduce the children about the harmful effects of tobacco. We believe that stories can be a powerful way to send messages. So we also have storytelling sessions. We also screen a documentary movie about this. And we also have a talk from a cancer survivor. This is especially powerful because students can see the effects of tobacco. Next, we have the CAT leadership program. It is a 1-day training program for children between 8 and 18. Here is the methodology adopted. We have storytelling, we screen a documentary movie, we have a talk from a cancer survivor, we have a role play, and we have activities for team building. CAT leaders are based in Chennai, Trichy, and Pudukkottai. I am a CAT leader who is based in Trichy. Here are the results. So we basically have 600 CAT members. We have 168 CAT leaders, 12 CAT officers, and 5 CAT units. So the CAT executive body comprises of a president, a vice president, a secretary, joint secretary, treasurer, and these are all elected by the CAT members. We have a CAT officer who is an adult who guides the CAT members in their activities and functions. CAT is an organization that is for students and it is by the students. So we have CAT leaders who are children who attend the leadership program, and we have CAT members who attended the introductory lecture. Here is my personal experience with CAT. So I have been associated with CAT for a very long time, since my childhood. In 2015, I attended an awareness campaign at Youth Health Mela, where CAT was one of the organizing partners. And later on, I attended the CAT leadership program and I became a CAT leader. And now I have the privilege of being the keynote speaker for many national and state level webinars. So my responsibility is to create awareness among students and family members on the harmful effects of tobacco. I believe that as much as we have peer pressure, which, is a force for the bad, it is causing people to smoke. At the same time, you can also use peer pressure for good things, such as creating a culture of health where people don't smoke and they don't use drugs. And I think it's a great way to spread awareness as well. I report any violations of anti-tobacco laws through the tobacco monitoring app. I played the role of speaker and coordinator for the webinars for sensitizing students, which is usually conducted on special days such as Children's Day and World Cancer Day, and also World No Tobacco Day. I played a vital role in various online signature campaigns to support an anti-tobacco laws implementation. And this is my personal experiences, but there are so many CAT leaders who have incredible stories, and we can't wait to hear them throughout the webinar. So here is the social impact. So CAT actively boycotts any companies which are in relationship with tobacco producing industries. We also have stories of how children encourage their parents to quit tobacco, and we also have many talks in schools where cancer survivors who in partnership with CAT encourage students to not enter into the use of tobacco. So this is only some of the examples of our social impact. And here is the tobacco monitoring app. So whenever within the 100 yards of a school, there are any vendors who sell tobacco, CAT members identify that and they report it to their CAT unit. Then the violation made is reported in the tobacco monitoring application. So if a violation is noticed, then we also register a formal complaint through the app, and the issue is followed up with the authorities, and we make sure that this app is being used regularly, because there are many times where the 100 yards rule is being violated. So here are the challenges that we particularly face. The first thing is receiving permission from school authorities. This is oftentimes, schools don't have time for, or they don't give priority for programs such as this, because school is already a long journey for people and it is hard for them to allocate time. But we believe that allocating the time is very, very important, since students spend most of their time in schools. So doing like these programs in schools is a great way to spread awareness. They also give less importance to cat, because maybe they are not as knowledgeable about the current problem, because a lot of the times tobacco and other drugs are being integrated into our society as a cultured thing to do. And apart from that, the sale of tobacco continues to exist near educational institutions. And it is also found that in the beginning, schools are very enthusiastic, but later on, they kind of lose that enthusiasm. So these are some of the challenges that we face, but it is a challenge that we are continuing to defeat, and we will continue to do so. In conclusion, tobacco-free institution is a fundamental right of every student. So I had a privilege of growing up in a tobacco-free home and also a relatively tobacco-free school. But this should not be a privilege. This is a right that every student should have, and every student needs to use their voice to advocate for themselves. It is imperative that we sensitize students and empower them to spearhead the creation of tobacco-free environments. CAT stands for social change, and we rally the younger generation to take charge of their well-being and influence a positive shift in societal norms. By spreading awareness, providing education, and promoting advocacy, CAT empowers students to unite against the tobacco epidemic. Like I said, I am very privileged to be in this position, and I also want more students to come ahead and to speak for themselves, because we are a power for good and we must use it as well. Thank you so much for giving me this opportunity. And next up, I would like to invite my dear friend Mahip to deliver their speech as well.
Good morning to everyone present here. I am Mahip. I am in grade 12th. I am from Punjab. I study in Guru Harkrishan School, Chandigarh, and I have been given this honor to speak at this prestigious conference. I would be speaking on the topic of protecting the children from tobacco industry interference. First of all, we need to understand how this industry works. The tobacco industry has a long history of targeting children and youth as their potential consumers. Scientific evidence shows that tobacco company advertising and promotion influences young people to start using tobacco. Adolescents who are exposed to cigarette advertisements often find the ads appealing. The more exposure to tobacco advertising, the more likely they are to start smoking. Tobacco pushes their message by placing ads, big ones, in magazines and social media platforms which are popular among the kids. The tobacco industry spends billions of dollars on ROI each year in order to get young people to start smoking and to keep them smoking. The ads are very appealing since they suggest that tobacco use will result in a positive self image, peer acceptance, and popularity, and to look cool in today's world. Now, coming to the next most important point, how to protect the children from this interference. Protecting the children from the insidious influence of tobacco companies requires a multitasking approach involving policy reforms, education, awareness, and community engagement. Awareness among the youth about the facts and the risks of consuming tobacco. Awareness among the youth about the facts and the risks of consuming tobacco. Nicotine works on the brain. It creates a relaxing and pleasurable environment, which also makes it harder to quit. Smoking tobacco puts you at risk for cancer, stroke, heart attack, and other diseases and health issues. Smoking one cigarette a day can take 11 minutes of your life. Smoking is not only a killer, but a serious cause for many other illnesses. Smoking also affects fertility. Policy interventions. Tobacco advertising should be restricted not only on traditional media but also on online platforms. Taxes should be increased to make the products less affordable for the kids, and the revenue generated from the same can be directed towards the public health interventions. The age for the use of tobacco products should be made 21 years. I strongly believe that the flavored tobacco products should be banned as they are very alluring to the kids. Enforcing strict smoke free laws in public spaces and schools will reduce children's exposure to secondhand smoke as well as the decreasing in the normalization of smoking behavior. Implementing comprehensive tobacco prevention education in school will help equip the children with the knowledge and skills to resist the tobacco industry manipulations. All tobacco and nicotine product advertisings and promotions in the forms that are accessible to the children should be prohibited. Depiction of tobacco and nicotine products in movies and shows that can be seen by the children should also be restricted. Educational initiatives. Teaching media literacy skills enables the children to critically evaluate tobacco advertisements and recognize the manipulative tactics used by the industry in order to get them to start smoking. Educating parents about the dangers of tobacco use and the tactics employed by the industry empowers them to create tobacco-free environment at home and advocate for stronger policies. Empowering young people to advocate for tobacco control measures and to raise awareness about the harms of tobacco use can be an effective way to combat the industry interference. All the adolescents should have a regular checkup in order to see if they are using any such products. Despite progress in tobacco control, several challenges and limitations persist in protecting children from industry interference. These include the industry's continued adaptation to regulatory measures, insufficient funding for tobacco control programs, political barriers to implementing these effective policies, and other communities. Overcoming these challenges requires sustained commitment, resources, and collaboration across all the sectors. Monitoring and surveillance. There should be strict monitoring on tobacco industry activities, and there should be regular checkups on whether the tobacco industries are following the laws, and the promoting transparency in the interactions between the government officials and tobacco industry should be made permanent, as this will help hold them accountable in the policy making. Imposing significant penalties on the tobacco industries if found guilty of not following the rules. To conclude, protecting children from tobacco industry interference requires a comprehensive approach that addresses policy reforms, education, regulatory enforcement, parental involvement, product regulation, and global cooperation. By addressing these challenges and implementing evidence based strategies and prioritizing the well being of our youth through collective efforts, society can create a future to safeguard children from the harms of tobacco and where every child has the opportunity to grow in a tobacco free environment. Thank you.
Thank you very much, Maheep. It was a very insightful speech, and definitely we need action from both the end of institutions and from our side to create a tobacco-free environment. Next up, I would like to call upon Ms. Kayal Hasantika from Chennai. She is going to be speaking about World No Tobacco Day as a tool for knowledge and empowerment in tobacco control.
Good morning, each and everyone. Personally, I appreciate you all for sparing your valuable time for such a good cause. As I greeted you all as each and everyone, I would like to invite attention of every single person towards a topic which has a huge sense of responsibility that is to be created in our ecosystem for ensuring better tomorrow. As you are all aware that the intrusion of tobacco into the society increased exponentially and it has impacted a huge volume of individuals irrespective of their gender, age and brought up. Why this happened during recent past? what is the implication way out of this issue? On all these attributes, I am going to share my thoughts and opinion to this beautiful audience and hope I will be the building block to build this concrete wall which separate our fellow men from this exploiting agent. யாதும் முறை யாவரும் கேளீர். These lines from Kaniyan Pungundranar and highlighted in the world summit by our beloved late missile man APJ Abdul Kalam. I admired the way our ancestors lived and their thought process. Wisdom is the key to solve many problems which we are facing now. From this line, I would emphasize that each and everyone should think each other as their kin and try to avoid ignoring them in our society. The isolation is the main reason for an individual to incline these kinds of addiction. As a responsible individual, we need to educate our children and dependent about the impact of this addiction. The major concern about the individual may not be limited to few disorders in terms of their health, but the effect it creates in their life and their dependence. These habits causes lack of focus and deviates a person from normal healthy life. Addiction also brings low self-esteem in adolescents and teenage segments that manifest poor performance and failures in individuals, which ruins their entire future. This psychological illness requires special care to these victims and consistent attention to them personally by encouraging them with positive advice and channelizing them for betterment. So, who is going to do all these things and to whom they are going to recover is the big question in this half. Simple. If you are ready to lend our hands for these most needed issues in the society, then that the desire will make into contribute. Nowadays, there are many NGOs and recovery centers for this issue. We have to rehab others to know about it and help some individuals who are drowning in this addiction. In simple words, I request you to please volunteer in this campaign and try to support to save our friends. Thank you.
Thank you so much, Kayal. It was a wonderful speech. And I definitely agree. We all need to hold hands and we all need to fight against tobacco as a community. Next up, I would like to call Ms. Sonika B. from Bengaluru, Karnataka. She is going to be speaking about the role of educational institutions in tobacco control.
Hi, good morning all. My good name is Sonika B. I am studying in 10th standard Brian Center Blossom School. I am located in Bengaluru, Karnataka state. Today I am going to speak about role of educational institution in tobacco control. Moving on to the topic, tobacco consumption is considered to be one of the most avoidable causes of premature mortality. In 2004, the World Health Organization WHO successfully negotiated the Framework Convention on being a control to work on towards the tobacco. And consumption gradually being a singularity, India has implemented several programs to control tobacco consumption. Educational institution plays a critical role in tobacco control to several key points. And number one, education awareness. Schools and universities can educate students about the health risks associated with tobacco use through comprehensive health education programs. These programs should include information on the danger of smoking, secondhand smoke, and the benefits of quitting. And second point is creating a smoke-free environment. Implementing and strictly enforcing smoke-free policies on campus can reduce exposure to secondhand smoke. And implementing and strictly enforcing tobacco-free policy on campus can reduce exposure to secondhand smoke and denormalize the tobacco use among the students. Offering the support for students and staff who are wishing to quit the smoking, such as counseling services and access to cessation programs, can help you reduce tobacco use within the institution. And moving on to the third topic, youth engagement and peer influence. Schools can empower students to take an active role in tobacco control by involving them in a peer education and advocacy programs. This can be amplify the anti-tobacco message through relatable sources, community outreach and collaboration. Educational institutions can collaborate with local health departments, NGOs and community organizations to extend tobacco control effects beyond the campus. Hosting community events, workshops, and campaigns can raise awareness in the tobacco control. Educational institutions are uniquely positioned to influence about individual behavior regarding tobacco use by educating students, enforcing smoke-free environment, engaging youth, collaborating with the community, and advocating effective policies. Schools and universities can apply a role in reducing the prevalence and impact of tobacco use. Tobacco use is one of the leading preventable causes of morbidity in the world. Globally, tobacco endemic kills 5.4 million people a year from various tobacco-related diseases. According to GATS, India 2016 and 17, 42.4% of men, 17.2% of women, and 28.6% billion of children are currently use tobacco. 36.9% of children are found inhibiting tobacco use through the age of 10 years. Almost 4.2 of students currently smoke cigarettes, and boys considerably higher than girls, while 11.9% of students currently use other tobacco products. 4 of out of 5% who use tobacco inhibiting in abundance and continue into adolescence. Tobacco use in increasing among the adolescents in addition usually carried out in there. And another trend noticed these days among is tobacco purchase and usage being shifted to alternative products like electronic delivery system, vaping, raising concerns due to increased public interest. And thank you for giving me such an opportunity and to serve against tobacco. Thank you.
Thank you so much, Sonika. That was an enlightening speech. Educational institutions definitely have to take a step in tobacco control. Next up, I would like to call upon Joan Pritika from Chennai. She is going to be speaking about child participation in tobacco control.
Hi, I'm John Pritika. I'm studying in 10th standard in St. Michael's Academy in Chennai. Today I will be talking about child participation in tobacco control. First, let's cover health risks. Preventable diseases. Tobacco use is a major cause of preventable diseases such as cancer, heart disease, and respiratory conditions. Reduction of health burden. Effective control can significantly decrease the incidence of tobacco-related illness. Public awareness. Controlling tobacco includes public education about the risks which can deter initiation and encourage cessation. Role of children. Educate peers. Children can participate or lead school-based health clubs or initiatives that focus on educating their classmates about the dangers of tobacco use through presentations, posters, and events. Next is economic benefits. Lower healthcare costs. Reducing tobacco use lowers the financial burden on the healthcare systems by decreasing the need for treatment of tobacco-related diseases. Increased productivity. Healthier populations lead to a more productive workforce as fewer people are affected by tobacco-related illnesses. Cost savings. Government can save on public health expenditures and use those resources for other critical health issues. Role of children. Advocate for policies. Children can engage in advocacy by writing letters to local government officials or participating in youth advisory councils to promote tobacco control policies, emphasizing the economic benefits or reduced healthcare costs and increased productivity. Youth protection, reducing access. Implementing age restrictions and controlling the sale of tobacco products can prevent youth from starting to smoke. Limiting exposure. Controlling advertising and promotional activities aimed at young people can reduce the likelihood of them starting to use tobacco. Educational programs. School and community-based programs can educate youth about the dangers of tobacco use. Role of children. Promote educational programs. Children can actively participate in and help organize educational programs in their schools that teach about the risks of tobacco use, helping to prevent their peers from starting to smoke. Environmental impact. Litter reduction. Controlling tobacco can reduce environmental pollution from cigarette butts and packaging. Sustainable farming. Encouraging sustainable practices in tobacco farming can mitigate environmental damage. Chemical use. Reducing the use of harmful chemicals in tobacco cultivation benefits the soil and water quality. Role of children. Organize cleanup events. Children can organize or participate in community cleanup events to remove cigarette litter from parks, streets, and other public areas, raising awareness about the environmental impact of tobacco use. Public health policies, regulation and legislation. Implementing strict regulations on tobacco sales, advertising, and pricing can curb tobacco use. Taxation. Higher taxes on tobacco products can reduce consumption and generate revenue for public health programs. Warning labels. Mandating graphic warning labels on packaging can inform consumers about the health risks of smoking. Role of children. Advocate of regulation. Children can get involved in local advocacy efforts, such as attending city council meetings and speaking out in favor of stricter tobacco regulations and policies. And the last is supporting for quitting. Cessation programs. Providing access to smoking cessation programs and resources can help individuals quit. Healthier alternatives. Promoting the use of nicotine replacement therapies and other aids can support those trying to quit. Counseling and support groups. Access to counseling and support groups can provide the necessary emotional and support for quitting. Role of children. Promote cessation programs. Children can help promote smoking cessation programs and resource in their communities by creating and distributing informational brochures and inviting guest speakers to schools to discuss the benefits of quitting smoking. In conclusion, children play a vital role in tobacco control efforts. By educating their peers, advocating for policies, promoting educational programs, and participating in community actions, children can drive meaningful change. Their involvement not only raises awareness and reduces tobacco use among youth, but also empowers them to contribute to a healthier and more equitable society. Engaging children in these efforts ensures a sustained and impactful fight against tobacco, fostering a future generation that prioritizes public health and well-being. Thank you.
Thank you so much, John. That was such an engaging speech. And I definitely think that we are paving the way for a future generation where we have tobacco-free environments as well. Next up, I would like to call upon Rowan, who's a fellow student from Tirchi, and he will be talking about the need for a tobacco-free generation.
Good morning to everyone. My name is Rowan. I am from Tamil Nadu, Tirchi. I am studying 11th standard. I am going to speak on the topic tobacco-free generation. This is something really more important because tobacco is not just product. It's a public health menace. It steals life, devastates families, and burdens societies with an enormous economic toll. Do you know that cigarettes have more than 7,000 chemicals and 250 chemicals in that are more harmful and it can even cause cancer. But in if our generation could be the one to kick tobacco to the curb, that means no one could worry about getting addicted to tobacco products. It can only happen if we take action. We should tell the danger of tobacco to smokers and make everyone to quit. And also coming children should not get the tobacco products. The government should give a law that lesser than 18 years old are not supposed to buy. The shopkeepers should not allow everyone to buy. Let's don't help tobacco companies. And I am concluding that do not use tobacco products and change happens smoothly when we remove tobacco products. Thank you.
Thank you so much, Rowan. Next up, I would like to call upon Pandya Namra from Vadodara, Gujarat. He will be talking about harnessing children's potential in tobacco control.
Okay, good afternoon, everybody present over here. Myself, Namra Pandya from grade 9th A. Good afternoon, everybody present over here. Myself, Namra Pandya from grade 9th A, and today I will be talking on the topic harnessing children's potential in tobacco control. Between 80,000 and 1 lakh children worldwide start smoking every day, roughly half of whom live in Asia. 21% of students are enclosed tobacco smoke inside enclosed public spaces. According to the global survey, total students are of 8.5%, on which 9.6% are of boys, 7.4% of girls, currently used any tobacco products. Tobacco, 13 to 15 years of children use tobacco products in the most countries. Impacts of smoking. The risks of smoking are as follows: brain damage, lung cancer, normal cancer, bone and muscle damage, heart disease, sexual disinfection, voice boxes larynx cancer, or even can lead to death. Cigarette can cigarette uses cigarettes is filled with the following compounds: tar, arsenic, lead used in paints, formaldehyde, which is a poison, mercury used in mercury barometers, polygenium, carbon monoxide, the smoke released from cars and scooters, nicotine produced from the tobacco plant, uh, cardamom used in batteries, and acetone. Children should be at the center of the tobacco control. Big tobacco countries target small children to increase their business products. But the question arises, how the big companies target small kids and youth? They use the 5 most valuable marketing strategies. First, uses bright color packaging that appeals to youth and attracts children towards them. Creates wide flavor options eliciting youth. For example, menthol, mint, elaichi, etc. Imitates easily concealable and sleek design or flash drives, pens and markers. Their box looks like a pen or flash drives. Makes smoking or vaping look cooler and more desirable. And considered it as a style. Gas station display e-cigarette at the eye level behind the cash registers. People think that e-cigarettes are healthy while they normal cigarettes, but e-cigarettes produce smoke inside our body while the cigarettes produce outside the body. The both are for our lungs. Tobacco industry interference. Here are some companies that use tobacco. Some, for example, Tiranga, Rajnigandha, Vimal, Elaichi, etc. Uh, Children also start smoking due to the role models such as Shah Rukh Khan does the advertisement of Vimal Elaichi. So most of the people who are whose role model is Shah Rukh Khan also start consuming the tobacco. So what children can do to prevent? So first, be the change agent. We must be ourselves. So we must be ourselves so that no one can interfere in ourselves. We must live a healthy lifestyle. Second, peer influence. Most of the people come in pressurized due to peer influence and hence start consuming smoke or tobacco. Teachers and parents involvement. Teachers and parents must involve in the cases of children's consumption. Teachers and parents must not consume any tobacco, or else the children might get tobacco from learning them. Policy advocacy and school-based campaigns we will learn in the further slides. First, be the change agent. How can we be the change agent? By first, teaching children about the health risks associated with tobacco use, providing information on tactile used by tobacco industries to target the youth, empowering children to make informed decisions about the tobacco. Integrate tobacco education by covering topics such as harmful effect of tobacco, addiction mechanism, and benefits of quitting the tobacco. The children must know why should we quit and the benefits of quitting tobacco. Second, peer influence. As early discussed, peer influence is the most valuable, is the most used peer influence is the most used. People pressurize in the peer and hence start consuming the tobacco. Also, people, also the adolescents, in the adolescents, the peer is more valuable than that of the parents and teachers. So, adolescents, are adolescents follow their peer rather than their teacher or parents. Teachers and parental involvement is must. Teachers and parents must not consume. A child or adolescent might from learning them and consume tobacco. School-based campaigns implement tobacco prevention program in school to reach a wider audience, providing resource and support for teachers to incorporate tobacco education into curriculum, organizing events and competitions such as drawing competition of tobacco-free living and also learning them about the tobacco. Current government of India is following 11th 5-year plan. Government of India launched the National Tobacco Control Program (NTCP) in the year 2007-8 during the 11th 5-year plan with the aim to create awareness about the harmful effect of tobacco consumption. Some of the acts taken by government are COTPA or COTPA 2003 Act, WHO World Health Organization FCTC Act 2004. Children needed to step up. I am a volunteer of Faith Foundation and we work on the slogan, be the change you wish to see in the world. Choose a healthy life. So this is the toll number 1800112356 is the toll number if anybody wants to leave. It must call on the National Tobacco Quitline number. So I conclude by breathe easy, live better, no smoking, no cigarette, ignite health and extinguish smoke. Thank you and have a nice day.
Thank you so much, Pandya. It was such a wonderful speech, and there was so much wisdom in that. So, since we are done with all the speaking, unfortunately, Atul won't be able to join us today. So, we can go ahead and start with the question answer session. So, to all the participants who are watching, please send in your questions and we will all take turns answering them. So, first up, we have a question from Syed. Syed asks, how can the initiatives of children sustain in the present scenario? Syed, this is a question that I've been having for a very long time actually. Because when we actually participate in programs like this, a big question that we have is how much of an effect is it really having? And how can we sustain this movement to go on? The first thing is to remember that every single action that you do is kind of a ripple. So today I am speaking in this webinar, and if any of you watching are feeling inspired, you should go and conduct your own webinars, your own sessions where you see your family, your friends, and you talk about this issue. Like I said, we need to spread the change slowly. Nothing will happen in an instant. So it's important for us to keep continuing this action. And if any of you have connections with schools or institutions, use your influence to make sure that you can create a tobacco-free environment for the people around you. Like I said, this movement has been going on for a long time and it will go on for a long time. But we need to keep fighting so that we can have a generation wherein they are not exposed to tobacco early on. So this is what I think. Would any of the other speakers like to give your own answers to this? We can move on to the next question. So we have a question from Nada, I guess, and they're asking, how can we make children engagement meaningful? So the way to make children engage in topics such as this is to, number one, make it fun and also make it attractive for them. Like this month, we had plenty of competitions. We had art competitions, we had poster making, we had reels making. Social media can be a wonderful way to spread this message, and children automatically will get interested when they see their friends get interested. So again, it's kind of like a ripple effect where we see one person get involved in the change, and then other people that they know can also get involved in a change. Like I said, it's going to be a long journey, a slow journey, but it is going to be meaningful. And I would like to remind all of the participants, the people who are watching, we have a feedback form which you can fill out, and you will be receiving a certificate by the end of it. And this feedback will go on to make sure that our further webinars can be even more meaningful and also more beneficial for all of you. And the link to the feedback form is in the chat, so go ahead and fill that out. So like I was saying, there are many ways to make this meaningful. A big way is organizations such as CAT, which is children-led. So if you know any children or you have any children, encourage them to join initiatives such as this. It is a great way to get involved from a young age. So the next question that we have is, as a student of NCC, what do you expect us to do? The first thing to do is, can all the speakers turn on your camera so that we can take a group photo together and commemorate this event? And also, please feel free to answer the questions as well. So all the speakers, please turn on your camera if it's possible. Okay, let's wait for a minute. Until then, let me continue answering the question. So if you are in a college, then the first thing to do is you yourself don't succumb to peer pressure and ensure that your friends also don't succumb to it. Like I said, we are not responsible for other people's actions, but at the same time, we can also ensure that we don't promote them to do a particular action. So if you have any friends who smoke or who are into drugs, then try to get them into a cessation program, or even make it known that you don't support them doing this particular action. That is one thing you can do. Another thing, hold your own webinars and meetings in a college. You can start your anti-tobacco club in a college. Many societies, maybe you can start a society and protest. There are so many ways, especially since you are in college, you have a lot more freedom to act. So these are just some of the ways. And apart from that, CAT is meant for children, but since you are in college, you can maybe start like college students against tobacco, like your own association. Like I said, it is really important for you to continue the change. So that question is done. And next we have a question from Elaine. How can a child join and volunteer with CAT? So we have like I said during my speech, we have an introductory program and we also have a leadership program. I will ask Ms. Adeline to drop in the contact number of the person whom you can contact to get in touch with CAT. So Ms. Adeline, can you please drop the contact number in the chat? So if you are interested, then you can text this number and you can get involved with CAT. Okay, next up, we have a question from Kate and Nitin Kumar. How do we get support from government to stop tobacco? This is a hard question, since this is a question that adults are also trying to figure out. And the thing is that to get support from the government, okay, also Adeline has given the number for CAT below. Any of the participants who know children, or if you are a child who would like to participate in this movement, please contact that number for further details. So yes, so to get support from government is not an easy task, but the first thing we can do is obviously movements like this, and also social media support. Like movements like this have also been advertised in newspapers, which can be so that the government can know that we are against tobacco. And the next thing is there are many protests that are going on that you can take part in. And obviously CAT is a beautiful way to do this. And next up, they also have a lot of legislations. There are protests that you can sign and you can take part in that. So like I said, to get support from government is not an easy thing, but spreading awareness is one of the easiest way to do it. And we are also fighting currently. We don't support any advertisements that include tobacco. And the fight will be long, like I mentioned before, but we have to continue doing it. So that is the question to that. Okay. Next up, we have a question from John Victor, who asked, why do you think that children are involved in tobacco? So would any of the other speakers like to answer these questions? Because I know a lot of you did speak upon child participation in tobacco. So yeah, please, the other speakers, go ahead and answer this question. I think you guys have great insight in this.
May I answer?
Sure.
Yes, I believe that the children are involved in tobacco because of the influence, because of the people they are seeing around us. For example, some children have parents who are using this stuff. We can ask them to stop it so that we don't have a bad influence. And children are also getting influence from social media and also seeing their favorite actors in using these products in real life as well as in movies. Uh, so if we can somehow stop it or put an end to it, then the influence of tobacco on children can be decreased significantly, and it will also help to make a better future for the children.
Thank you, Mahib. I hope that the question has been answered. So next up, we have a question from an anonymous person. They ask, I have a friend who used tobacco once and got caught, but she didn't now, and she doesn't want to use tobacco hereafter, and she is good now. She has been expelled from the hostel and doesn't have anyone to console her. So that is the question. I assume you want us to, give a further actions on what to do. So the first thing to do is, obviously you did it, you contacted an organization that is anti-tobacco, which is CAT. So great job on doing the first step. But the point is that your friend must be in great distress right now and they need psychological support. So if she has any trusted adults that she can talk to, and other than that, one thing you can do is be a good friend to her. A lot of the times when a person uses tobacco and wants to quit thereafter, a problem is there is so much shame surrounding the fact that you need help that people don't really ask for help. Like I said, the important thing is that she wants to quit now, and you can support her actions. If there are any local cessation programs that are available, you can join that. And there's also the helpline, the quit line that was given. She can contact that. But I do think the best thing for her to do is to contact a trusted adult who can support her through this time. And as a friend, don't shame her for for this event that happened, because clearly she's already distressed about it. And if you want support from CAT, then we also put the number below, so you can contact CAT if you want further support. And you did the first step by coming here, so great job, and continue supporting her through this. So thank you. Next up, we have a question from Ignatius. I'm sorry if I'm mispronouncing that. So what are the incremental actions that children can do on a daily basis to support the CAT initiatives? Okay, so would any of the other speakers to get addressed? Any of the other speakers, can you go ahead and answer this question so that I can manage the Q&A box now? Joan, would you like to go ahead and answer this question? It's a question from Ignatius, which asks, what are the incremental actions, small actions that children can do on a daily basis to support CAT?
Children on a daily basis can go and check the surrounding areas if there's any local tobacco shop that is being used and report it to the CAT Monitor app.
So great advice. You can definitely use the tobacco monitor app that I've mentioned to report any of the violations that you're seeing. Apart from that, the best way in which the children can actually fight tobacco is to talk to their friends about it. Like I said, peer influence is a big reason why people use tobacco. So you can also use it the other way, where you can influence your peers to not get into the culture of using tobacco. So that is a great way. Another thing they can do is Sorry for the noise. Another thing that you can also do is, join organizations such as this, where we have, poster competitions, we have painting competitions, we have reels making competitions. So these are all really fun ways to get engaged in the movement. So we also have a question: who introduced tobacco, which has been answered by Kyle. So thank you so much, Kyle. I will read the answer out. So Kyle says the tobacco was introduced by the Portuguese in 1605. Like, it's a very fascinating history of how tobacco actually came to India. I would encourage all of you to go ahead and search about it. So the last question that we have is: children are using drugs when they are depressed. This generation is getting depressed for silly reasons. What do you think about it? I think that it's definitely we know that this generation's mental health is not great, but a big reason about it, I do not think that the reasons are silly, because you think about it, children these days are expected to do so much. Like, you are expected to know about the career that you want by the time you finish school. You are expected to act like an adult, but at the same time you're also treated like a child. So I can go on about it, but I do think that there are no silly reasons to get depressed. Depression is a serious issue that children are facing, and the more you call it a silly reason, the more they are not going to talk about it. When you are depressed, the first thing you have to do is talk about it. And if you keep shaming them, saying that it's for a silly reason, they're not going to talk about it. They're not talking about it, then they turn to using drugs. So I think the first step is to stop calling the reasons silly and start addressing why people are getting depressed. Why do children get depressed? And beyond that, we need psychological counseling support at schools, which schools don't have. And then on top of that, we also have adults who call them silly. So there are a lot of issues here. And I think the first thing that we need to do is acknowledge that depression exists and there are no silly reasons to get depressed. So that is my opinion on this. So these are all the questions, and I don't think we have further questions. So again, I would like to remind you all that there is a feedback form and we have dropped the link in the chat. Please fill it out if you want the certificates, and we will be using the feedback form to improve our webinars. So would any of the speakers like to give your ideas or opinions if you have any? Oh, we also have an extra question. Okay, no, it's the same one. Okay. So would any of the speakers like to go ahead and share their opinion on the webinar, your experience with it?
May I?
Yes, go ahead.
Yes, my opinion on this webinar is I need to, I learn very much from this webinar. I was not knowing before the webinar that much. I now knew. I knew most of the things, the farmers facing problems due to drugs, the depression, etc. Thank you.
Thank you so much, Pandya. There's still so much to learn, and even like after being in this movement for so long, I still learn so many new things every single day. And webinars like this are a wonderful collaborative way to do it. So next up, Sonika, would you like to tell about webinar?
Thanks for giving me such an opportunity. This was my first webinar I'm attending, and I was really excited for it, and I learned so much from this. And I hope there is still more to learn. Thank you.
Thank you, Sonika. We look forward to having you at more webinars. Thank you for attending this and also taking part in this on a Sunday as well. So, Kyle, would you like to share your experience with the webinar?
My first webinar, and I learned many things from this.
So we have an extra question, 1 minute. Can MACT arrange awareness programs at schools in Trichy? This is a question from Seshachalam Kuppusamy. So, yeah, no, that is my grandfather. So Yes, we can definitely arrange awareness programs at schools in Trichy, and we have a plan where we are going to go in person to schools and talk about this. So great idea. We will be implementing it. Thank you, Mr. Seshachalam. So, Joan, would you like to share your experience with the webinar? Seems like Joan is having issues with the mic. Mahip, would you like to go ahead and share your opinion and your experience with the webinar?
Yes, I would like to share my experience. This webinar has allowed me to think about how much it is affecting, how much tobacco is affecting everyone. And it has also made me realize that it really needs to be stopped and it is affecting everyone in a bad manner. So maybe every child who is present here can do something to make an influence and to stop it in some way so that in the long run we can get a tobacco-free environment for the future generations.
Thank you so much, Mahip. It was a pleasure to have you. And like you said, I hope all the children watching this have an incentive to go ahead and talk to their friends about it as well. This is the way we spread change. So I think that is it for today. Unless and until anyone else have any feedback or opinion that you would like to share, please go ahead and share it now. I want to thank you all for joining us today. This was a wonderful occasion to talk about tobacco control, and I am so privileged to have all these wonderful speakers with me as well. So thank you to every single speaker. We have someone raising their hand now. Yes, you can type your question in the chat and we will be answering. Okay, they've been admitted. Okay. Yalinga, you can unmute and you can ask your question.
Hello, ma'am. My name is Salalinga. I am from in Bengaluru, Karnataka. Hello.
Yes, we can hear you.
Ma'am, tobacco. You talk to Hindi?
Yeah. I talk Hindi.
Yes, ma'am. मैम ये टोबैको है ना, बहुत लोग को प्रॉब्लम होते हैं। हम अवॉइड करना, हम बेंगलुरु में थोड़ा थोड़ा जगह में अवॉइड कर रहे हैं। वो भी वो भी नहीं हो रहा है। उसलिए मैम क्या करना है, ये टोबैको अवेयरनेस कैसा करना है, वो करने को हम बहुत बहुत मुश्किल कर रहे हैं। सब लोग मेरा बात सुना रहे नहीं है मैम। क्या करना है बोलो मैम।
Okay. My Hindi is not that great, but I will try. तो ये मूवमेंट बहुत मुश्किल ही होगा क्योंकि ये टोबैको मूवमेंट ना बहुत सालों से चल रहा है, लेकिन फिर भी वो बहुत धीरे ही दिखेगा क्योंकि हमारे सोसाइटी में ना जो हो रहा है वहाँ तो टोबैको बहुत ही कॉमन है, और इसलिए इसलिए ये तो हमें जानना चाहिए कि
Hi. Hi, sir.
Hi, ma'am.
You're from Bangalore?
Yes, madam.
I'm from Bangalore. Do you know Kannada?
Yes, ma'am. Kannada.
Yeah, you can speak in Kannada. You can ask me question. I will answer you.
ಇಲ್ಲಿ ನಾವು ಮೇಡಮ್ ನಾವು ಕರ್ನಾಟಕ ಪಬ್ಲಿಕ್ ಸ್ಕೂಲ್ ಅಗ್ರದಲ್ಲಿ ನಾವು ಹೆಲ್ತ್ ಮಾನಿಟರ್ ಆಗಿದ್ದೀವಿ. ಆದ್ರೆ ನಾವು ತಂಬಾಕು ತಡೆಗಟ್ಟೆ ಮಾಡ್ತಿದೀವಿ, ಸುತ್ತಮುತ್ತ ಅವೇರ್ನೆಸ್ ಮೂಡಿಸ್ತಾ ಇದೀವಿ. ಜನರಿಗೆ ಅರ್ಥ ಆಗ್ತಿಲ್ಲ. ನಾವ್ ಯಾವ ತರ ಅರ್ಥ ಮಾಡಿಸ್ಬೋದು ಅವ್ರಿಗೆ ಟೊಬ್ಯಾಕೋ ಬಗ್ಗೆ?
ಅಂದ್ರೆ ಅವ್ರು ತುಂಬಾ ಈಗ ಮೀನ್ಸ್ ನಿಮ್ಗೂ ಅರ್ಥ ಆಗುತ್ತೆ ಅವ್ರು ಎಷ್ಟು ಅಟ್ಯಾಚ್ ಆಗಿದ್ದಾರೆ ಅಂದ್ರೆ ಅದ್ ಬಿಡಕ್ಕೂ ಕಷ್ಟ ಆಗ್ತಿದೆ. ನೀವು ಬೇರೆ ವೇಸ್ ಅಲ್ಲಿ ಅವ್ರ ಕನ್ಸೋಲ್ ಆಗೋ ತರ ಏನಾದ್ರು ಟ್ರೈ ಮಾಡಿದ್ರೆ ಅದು ಅವ್ರಿಗೆ ಈಸಿ ಆಗ್ಬೋದು ಅಂತ ಅನ್ಸುತ್ತೆ. ಅವ್ರಿಗೆ ಅರ್ಥ ಮಾಡಿಸಿದ್ರೆ ಅವ್ರನ್ನ ಅಲ್ಲಿಂದ ಅಂದ್ರೆ ಡಿಪ್ರೆಷನ್ ಇಲ್ಲ ಅಲ್ಲಿಂದ ಆಚೆ ತಂದ್ರೆ ಅವ್ರಿಗೂ ಹೆಲ್ಪ್ ಆಗ್ಬೋದು ಮೇ ಬಿ.
ಎಸ್ ಮೇಡಮ್, ನಾವು ಟೊಬ್ಯಾಕೋ ಹೆಲ್ಪ್ ಲೈನ್ ನಂಬರ್ ಕೊಟ್ಬಿಟ್ಟು ಅವ್ರಿಗೆಲ್ಲ ಅವೇರ್ನೆಸ್ ಮೂಡಿಸ್ತಾ ಇದೀವಿ ಮೇಡಮ್ ಕೆಲವು ಕಡೆ.
ಹಾ,
ಓಕೆ ಮೇಡಮ್, ಥ್ಯಾಂಕ್ ಯು.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.
Sorry everyone, I got disconnected. Thank you, Sonika, for answering that beautifully. It was a great job, well done. So, okay, unfortunately, I'm not able to turn on my video, but I think that's it for today. Thank you everyone for joining us. It has been a great pleasure. to join you all. And we hope to see you at more webinars like this. Continue fighting against against tobacco. This is the only way we can move ahead. And thank you all for joining. I will be ending the session now. Thank you.
Thank you.
Thank you.
Thank you.
Thank you, ma'am.
Don't forget to fill out the feedback form, which is in the chat. Certificates will be given for people who fill out the feedback form. Thank you so much.
Thank you, all the participants, all the adults who have also involved in the session. I thank you on behalf of MACT and Dr. G.V. and Cancer Institute who have joined hands with MACT for this wonderful webinar. I thank Prajna for wonderfully handled the session, and it was thought-provoking. Thank you, one and all. Thank you.